Welcome everybody to your post-op class. Today we're going to talk about diet progression, the vitamin program and vitamin orders, and how to move forward with a lifetime of success. Does this look familiar to everybody? Yes. All right. We've got our weapons. That is your keyword, your foundation to long-term success. Water. Drinking 64 ounces of water every day. Exercise. We want to strengthen and maintain our muscles so that we can maximize our fat burning, and equally importantly, so we can keep that weight off long term. Protein. We're going to eat a low carb, higher protein diet so that we've got the building blocks to maintain muscle and so that we have good hunger satisfaction. The NS is no snacking. Think of this in a positive term. Think of it as fasting. Fasting is where the magic happens. We do not burn fat in a fed state. We only burn fat if we aren't feeding our body energy. We want to force that fat burning. That's going to happen during our fasting time. It's also when our cells have time to do all the other work they do, like DNA repair and protein synthesis. So we want to have ample time for fasting. So 3 meals a day, no eating in between those meals. Actively fasting. Supplements we're going to go into in great detail in a little bit, and then long-term support. So again, remember, weapons are the way. This is a very, very highly effective tool. But the magic, the weight loss, happens with the work that you're going to be doing. It happens with this program. It happens with the dietary changes we've taught you and we're going to keep teaching you. This is the magic. The surgery is just a tool. So sometimes people come back 5 years later and they're like, the surgery didn't work for me. I regained my weight. The surgery doesn't work for you. You use the surgery, okay? That's an important mindset to understand. You're the one doing the work here. You've just got a really awesome, powerful tool to do it with, okay? Use it well. These are the tools that you need to use this to maximize your results and, importantly, to keep them long-term, for long-term success. All right, today's the day. You get to advance your diet. I know everybody's sick of broth and just drinking liquids. So keep in mind your fluids are still the most important thing. 64 ounces of water a day is absolutely critical. It helps with healing, flushes waste from the body. Drink consistently throughout the day. You've got a brand new, smaller stomach. You can't chug water like you used to be able to do, okay? Sip it and drink it consistently throughout the day. You want to be drinking sugar-free, clear liquids. Now, you guys all know how I feel about artificial stuff. We want to minimize artificial flavors, artificial sweeteners, artificial colors. They're not good for our gut microbiome. We don't want to continue to train our body to like sweet things. It's better to flavor your water by seeping in mint leaves, cucumbers, lemon, lime slices. Let it seep overnight or for a day. Use that as flavoring your water. It's going to be far better for you, both short-term and long-term, for flavoring water so you can help get that hydration in. However, if that doesn't work for you, and the only way you can get in your water is to use some Crystal Light or a little bit of Gatorade Zero or what have you, that's fine. Most important is to get the water in, okay? Now, this is the hardest thing you're gonna have to adjust to. You can drink up until your meal, but once you start eating, we need you to stop drinking and we need you to stay without drinking for an hour after your meal. This helps keep that food in your smaller stomach longer, helps those receptors in your stomach continue to tell the brain, we've had enough to eat, we've had enough to eat. Keeps you from overeating because it keeps that food, again, in that smaller stomach and isn't flushing things through so that you can eat more. It's an important long-term skill and habit to develop. It is very hard to adjust to, I will tell you that. But you can do it, and then it'll be a habit and you'll be used to it. Exercise. We've talked about before the importance of using your muscles. Your muscles contain the energy factories in your body. This is how we keep your metabolism up so that you can maximize how much you lose and keep it off long term. You've got to keep your muscles strong, okay? So Cardiovascular is good, weight resistance is good. Strength and resistance training are really important to maintain that muscle mass. If you haven't taken advantage of the Texas Physical Therapy group next door, I encourage you to do so. They can teach you how to work smarter, not harder. They teach you how to exercise in a way that burns fat, maintains muscle. Really important. I encourage you to try them out and use them, even if just go a few times to learn how to do this and what kinds of things to do. Very important for long-term success. Keep those muscles strong. Okay. Your stomach is a muscle and it is still healing. Okay, imagine, excuse me, if a week ago we cut through your deltoid. All right, it would hurt, right? And you wouldn't be lifting, weights right now. Okay, it's got to heal. It takes time. Your stomach has been cut. So you got to treat it very gently. As you start advancing your diet, you got to be really, really gentle. You're going to start with very soft proteins, and you're going to try one new food at a time. You're going to treat it like you would when you start feeding a baby, right? We start feeding a toddler, we don't give it steak, right? We start with mushed up meat, and we don't give it 5 different foods in one time, right? We start with one thing at a time. That goes okay, then we can add another thing. Treat your stomach kind of the same way, same concept. It's really a new stomach, and you're retraining it to eat. Now, again, 2 to 3 times a day only for meals. All the rest of the time, we need to be purposefully fasting. The process of eating is just as important as what foods you eat. You want to take small bites, and in the beginning, I'm talking the size of a pea. Chew it to the consistency of baby food, and then swallow. You're going to pause between bites. You're going to think of this mindful process. So as you're eating, you've all heard this. If you eat until you're full, you've overeaten. It takes a while for that message to get, those stretch receptor messages to get to our brain that tell us we've had enough to eat. So keep in mind that when you want to focus on, am I still hungry, and satisfying hunger rather than am I full yet, okay? And that's a habit that's you can slowly develop by practicing it. Take a bite, take 2 bites, and put your fork down and say, like, all right, am I still hungry, or is my hunger satisfied? That is what we want our goal for eating to be, rather than, am I full yet? Oh, I'm not full yet, I'm just gonna keep eating. We wanna seek satisfaction of hunger. Don't push it. We've all heard about, can my pouch or can my sleeves stretch out? They don't stretch out and get big and stay big, but they do get stretchier. So it's just like when you blow up a balloon for the first time, it's really hard, right? So what do you do to make it easier to blow the balloon up? Stretch it. It bounces back to the same size, but it's easier to blow up. And your stomach is the same way. So if you do that, one more bite, if you do that over and over again, you're stretching that balloon and you're making it more stretchy. So if you want to keep it nice and small and tight and effectively limiting how much you eat, you want to be careful not to do that one more bite. You want to really focus on stop eating when your hunger is satisfied. Protein shakes and protein bars do work as a meal replacement, but your meals need to be within 30 minutes. So sipping on a protein shake all morning is not, that's like eating 6 meals, right? A meal is 30 minutes. You may not be able to finish a whole protein shake in the beginning. You probably won't. I can only eat a 1/4 of it. That's fine. Whatever you can eat in 30 minutes is what you eat for that meal. Then you put the rest away for your next meal. You worry like, I'm gonna starve to death. Well, you're not gonna starve to death because we can go weeks and weeks and weeks without food, and you are getting some nutrition. You're forcing your body to burn fat, and you're importantly creating that habit of eating 3 times a day and fasting in between. You're gonna be fine. We're gonna start your vitamins. You're gonna be fine. The most important thing right now is to establish these habits that are gonna carry you through for long-term success. We want you successful for a long time, not just for a year or 2, okay? Building these habits is the most important thing. you're gonna be entering stage 2. So soft, mushy proteins. This is where we're gonna start. Things like eggs, beans, cheese, particularly soft cheese like ricotta cheese, cottage cheese, mozzarella string cheese, people usually tolerate pretty well. Greek yogurt, you want Greek yogurt because it's higher in protein. Some of the Healthwise products are designed for bariatric patients. We've got some examples of those up there, but we have like a Healthwise oatmeal. Oatmeal in general is not a food we want you eating, but if it's the Healthwise one where they make it basically no carbs and only protein, those are okay. Protein shakes and bars can be used. You can use a protein shake for the rest of your life for a meal replacement if you want to. We, again, keeping in mind we try to minimize artificial sweeteners and flavors, we typically say we like you to transition to solid and real food. But for some people it really works to have that meal replacement long term. It helps them stay on track, and that is okay. That works for you. Be sure you're always choosing protein first, okay? So do y'all remember from the beginning our healthy plate handout that has the plate, and then it's like half veggies, mostly protein, and then that little sliver of carbs, right? Okay, so the protein right now is really all you're gonna be eating. At this stage of stage 2, you can't eat a whole lot. So it's really important that what you're eating is protein, because we've gotta give your body the building blocks for that muscle. That's the most important thing, is that we maintain muscle mass. Your vitamins are gonna give you all the other stuff you need, okay? You'll eventually get to adding vegetables and a little bit of fruit. But protein is the one thing you've just gotta eat. So that's all we want you worrying about in the beginning, is getting that protein in. Soft textures, try one new food at a time. Our goal eventually is that you're getting in about 60 grams of protein, 60 to 80 grams of protein a day. You're not gonna do that out the gate. Don't worry about it right now. All you need to worry about right now is eating a little bit 3 times a day and making sure it's all protein. But eventually, as we progress your diet, we're gonna shoot for a goal of 60 to 80 grams of protein a day. And then you're gonna be able to progress on. As a matter of fact, if you look at the back of your sheet you picked up, it's talking about this right now, the stage 2 semi-solid foods. Starting week 2, that left-hand column is the softer ones, and then you're gonna advance over to some of these more textured proteins. And that's gonna be, again, continuing things like eggs, but adding chicken, tuna, some canned meats, soft fish, thinly sliced deli meats, beef, chicken, and turkey. You can start adding these in. The moist cooking methods like slow cookers or pressure cookers are really helpful to make those meats soft. You know, you want it easy to chew, right, as you advance into this second stage of stage 2. And then you're going to be able to move on to stage 3. This is typically about 4 to 8 weeks from now, okay? You're going to gradually increase the texture of your protein. Continuing to keep in mind our goal is 60 to 80 grams of protein a day, using that mindful eating, purposeful fasting in between our meals, and not drinking with our meals and waiting for an hour afterwards. Okay, and some examples again of good solid proteins: beef, game, deli, lamb, pork, poultry, shellfish, and the softer proteins are as fine as well that you ate earlier on. Non-starchy vegetables, salads. This you can start in stage 3. So again, we're talking 4 to 8 weeks out. We love veggies because they're high in fiber, they're low in calories, they've got a lot of phytonutrients that are really important for our cells to do their work. You know, salad dressing, the best salad dressing you can do is to make your own. Use some olive oil and some balsamic vinaigrette. Throw in, you know, a little teaspoon of some Dijon mustard, some salt and pepper. The olive oil is a very healthy fat. Avocado oil, also a healthy fat. You're better off with that than some of the low-calorie dressings they sell in the stores that add a lot of artificial junk They add sweeteners and other things that aren't good for you. You're better off with good old olive oil, some vinegar, plus or minus some honey or other seasonings for salad dressings. And the fat in the oil helps you absorb some of the vitamins and nutrients that are in these veggies, okay? Fresh foods and frozen foods are the most nutritious. Canned foods are okay too. Usually we're gonna start with cooked vegetables in the beginning, see how you tolerate those, and then advance on to raw veggies. So some examples, this is all on your healthy plate handout you got previously. Remember that peas, corn, potatoes, sweet potatoes, those are starchy vegetables. Those do not count when we're looking at that picture of our plate where it's half protein, half veggies. These, potatoes, sweet potatoes, peas, and corn are starches. Those go in that little sliver, okay? That does not count as our vegetables. That would count as a starch. So, again, remember, about 10% of your meal can be a carbohydrate. That's not a lot because you guys can't eat a lot. So 10% of not a lot is really not a lot, all right? But when we're talking about good carbohydrates, what we're talking about are fruits. We're talking about dairy products, beans, okay? Those are quinoa. And those are, again, listed on that healthy plate handout that you have. Those are what we're talking about when we talk about carbohydrates. We do not want you eating processed carbohydrates, bread, rice, pasta, okay? Crackers, chips, sweets. Here's the thing. Some people say, it's not healthy to eliminate a food category, it gives people issues. Okay, fine. But what you need to consider is this. We are, all of us, every last one of us, addicted to processed carbohydrates, without exception. We are all addicted to these foods. So we have to approach processed carbohydrates like we would approach any other addiction. You're not going to tell a person who struggles with alcoholism that they can have one shot of whiskey a week, right? Because it's going to derail them. I encourage you to consider processed carbohydrates as a serious addiction that you need to avoid at all costs. Not just now, not just for your first year, but for the rest of your life living on this planet. Because they are not good for any of us. And we are all, to a certain degree, addicted to them. And for a lot of us, that one bite, that one tortilla, that one derailment is what sends us down. It wakes the dragon. Don't wake the dragon, right? You've all fought with this, right? I know you have. I fight with it. We all fight with this desire to eat those foods. And having surgery is an amazing tool because it really helps cut that and reset things. But don't be fooled. If you go back into that pattern, if you dip back into that, you are waking up that dragon. And you will be back to fighting that beast every day. So I really encourage you to look at this like you would look at a person who struggles with alcoholism, looks at alcohol. Because it is that addictive. The same part of our brain lights up when we eat processed carbs as lights up when we do heroin. Heroin, y'all. Same reaction in our brain, okay? You get all the nutrition, all the fiber, all the things you need by eating healthy proteins, non-starchy vegetables, and natural carbs like fruit, like beans, like dairy, quinoa, okay? Poorly tolerated foods. In the beginning, foods that have a lot of acid tend to maybe upset your stomach in the beginning. Dry meats, white chicken breast meat, sometimes kind of hard. Stringy vegetables like celery. Sometimes some of these things are a little harder in the beginning. If you don't tolerate a food, it's okay. Set it down, wait a few weeks, and you can try it again. Caffeine is a diuretic. We've talked about how important hydration is, right? Caffeine makes you urinate. So it's really important that you avoid caffeine right now. We want you focusing on hydration. Decaf is fine. Decaf is fine. But also be careful when you do, even if you have decaf, remember that you don't want to be adding a bunch of sugary stuff to your coffee, okay? That's the same thing as, if it's coffee or water or anything else. We want to minimize artificial sweeteners and flavors. Getting used to black coffee is something I haven't been able to do. It did take me a long time to get off of putting sweeteners in my coffee, but I will tell you a trick I learned: cinnamon. Cinnamon in my coffee gives it a little hint of sweetness without actually giving it a sweetener or a sugar. If you have to have cream in your coffee, use cream. Use half and half, okay? I know that sounds crazy. Yes, it has more calories than the fat-free, sugar-free stuff you can buy in the store, but your body doesn't know what to do with all that fake junk. Use a little half and half in your coffee. That's okay. That is better than using fake artificial junk, okay? But really, no sugar. We want to avoid alcohol for the first year. You all heard me or our dietitian talk about the concern with transfer addiction. We are dependent on food, and we're taking a huge part of that away right now. You're making a choice to not use food for pleasure, for comfort, for enjoyment. So often people tend to go to a different something for that, and one of those sometimes is alcohol. We don't want that to happen to our patients. So we really want you to avoid alcohol for a full year. Let your body transform without that as a crutch. Also, it's liquid calories. We don't want you drinking liquid calories, and also it suppresses your ability to stay on track, right? It lowers your inhibitions, makes you more likely to grab those chips at the table if you're drinking a margarita, right? So for a multitude of reasons, we want you to avoid alcohol completely for the first year, and after that, just on special occasions. Also, particularly for our bypass and switch patients, the absorption of alcohol it's a lot more toxic to your liver, okay, than prior to surgery. The way it's processed now is different. So another very good reason to avoid it. Carbonation we want to avoid as much as possible. Those bubbles expand. It can reduce our feeling of restriction close to meals. And again, we've already talked about limiting artificial sweeteners and sugar substitutes. If you are a sugar addict, monk fruit and stevia products are more natural for you than the other artificial options for sweeteners. Dumping syndrome can happen, particularly to bypass patients. When you eat certain sugars, starches, which are foods we shouldn't be eating anyway, but if you do, you can develop dumping syndrome. You'll feel sleepy, flushing, sweating, heart pounding, lightheaded, nauseated, abdominal pain. You might vomit, you might have diarrhea. Have I convinced you this isn't a good idea yet? Okay, really, really not an enjoyable experience. You're not dying, you're not, nothing terrible is gonna happen. You're just gonna be miserable for about 30 minutes to a couple of hours. It's a good reminder to stay away from sugars and starches. Okay, we're gonna jump into supplements. Does anybody have any questions about diet right now? Yes, ma'am.
So we're not supposed to go straight to like the what's that called, stage 2?
Yes, you are. So you are now in stage 2.
Oh, okay.
Yeah.
Okay.
Yeah, so stage 1 was liquid diet. You all are graduating from stage 1 right now. And stage 2, starting at week 2, right now, that's where we do these softer proteins. And then when you're good with those, you can advance to the thicker proteins. And then when you get to stage 3 is about weeks 4 to 8, you're gonna go on to stage 3. All of these things, by the way, as a reminder, are in the nutrition guideline, which is on our website. So you go to patient success, and under there is patient education. And you will see the nutrition handbook that goes from start to finish, all the details of all of these things. Yes?
Yeah, I'm so sorry to ask, but what would be a good example, like right now, for stage 2 to be able to eat something after we leave?
Okay, when you leave here, I would look on this left-hand column. So Greek yogurt, good source of protein, good healthy fats in there. Cottage cheese, refried beans, mozzarella string cheese, scrambled eggs. These are all good, really soft starter proteins.
And then you said the meats would have to be grinded or really refined?
Yeah, so once you do well with these softer ones, you can move forward to like canned meats. Those are typically tolerated pretty well. You can mix them with a little bit of like, some a little bit of gravy or a little bit of broth if you need to. Just chop it up really, really well. And then when you advance to stage 3, weeks 4 to 8, you can start, trying thicker textures.
Thank you.
Sure. Sometimes in the beginning, people will get one of those baby food grinders and kind of puree their meat. That helps in the beginning. Okay, you will need vitamins and minerals for the rest of your life, no matter how great you feel. All right, that's a very important thing to know. There are deficiencies that develop slowly. Vitamin deficiencies don't scream at you, they whisper, okay? They don't make themselves known until they're really bad, okay? So you're not gonna know you have a copper trickling down over the course of years. You're not gonna have any clue until you all of a sudden start having, balance issues, neurologic problems, and you may not even recognize what's going on. And you might go to your PCP and you might go to a neurologist, and your neurologist might know, you've had bariatric surgery. We should check your copper level. We should check your selenium level. But in general, these are not things that you're gonna just sort of notice. It's really important that you take bariatric vitamins and that you see us every year so that we can check those vitamin levels. If you're a traveling patient from out of state, your primary care doctor will have received a packet showing them every vitamin level and element that needs to be tested, what to do when it's low, how to treat it, and they all have our number if they have questions, okay? So whether you're here or with your doctor out of state, it's super important that you get bariatric vitamin levels checked every year. And the bariatric specific vitamins are designed to help you maximize that absorption, okay? So no matter which surgery you've had, your vitamins are no longer going to this part of your stomach, okay? And that part of the stomach is where a lot of our vitamins are absorbed, okay? So the bariatric vitamins that are good, there's a lot of them that aren't good, but the good reputable bariatric vitamins have modified chemically some of these vitamins so that they can be absorbed in other parts of our intestine, okay? So there might be a great other vitamin that you know about, but if it's not designed for you and your new anatomy, you may not absorb it well, okay? So bariatric vitamins are really, really important. We can see drastic differences in lab values between people who are on them and who aren't. We're gonna go over some of those options. There are, I'm gonna show you, well, actually I'll go grab it. We have a sheet over here and there are pens that will show you a lot of options for your multivitamins. There are 3 a day, there's 1 a day, they're chewy, there's one that can be put in liquid. Some of them, and it'll tell you on here, for example, the multi-chewy bites, is only for sleeves, and it'll say that. It's not adequate for a bypass or a SADI or a switch. This advanced multi-EA is recommended for SADI and switch patients. Sleeves are welcome to do that too. So there are a couple little things in there like that. To note, the solo 1 a day vitamin is awesome for those of us who have a hard time remembering to take pills. However, they are very potent and are typically not tolerated very well in the first few months. So I encourage you to start with one of the ultra multivitamin. It's 3 a day. Don't take them all at one time because that's the same as taking the ultra solo, and it doesn't do very well. It doesn't go down well, but you can do 2 at a time. And then 1 another time. I strongly encourage you to not take these in the morning, any vitamin. There's just too much acid in your stomach, you haven't eaten enough, it can cause a lot of stomach upset. So I would recommend doing 1 in the afternoon, 2 at bedtime is a good system. Do them later. Whichever one you choose, we have schedules over there. So say you get the Ultra Solo, find your vitamin that you're deciding on and grab a little schedule, and it gives you kind of an idea of the way to time them. Calcium, we used to say you need 1,500 milligrams every day. The ASMBS has modified their guidelines to 500 milligrams of a supplement a day. So we do recommend you take calcium, but you really need to make sure that you're choosing a calcium citrate, Many over-the-counters, most over-the-counter calciums are calcium carbonate, which is basically crushed up seashells. The problem is you won't absorb that, okay? They're cheaper, but you're not gonna absorb them, so you're wasting your money. You wanna choose a calcium citrate. And there are some good over-the-counter calcium citrate brands. They don't have to be bariatric specific, but they do need to be calcium citrate. So just make sure you're getting 500 milligrams of calcium citrate every day, and that you're doing your bariatric multivitamin. And for most people, that's it. It's not complicated, but it's really important, okay? Now, we sell a variety of brands here that we have vetted out. We've been doing this for 20 years. We have good results with these brands, these companies. You do not have to buy them through us. We do try to make sure we meet or beat prices on Amazon because we want to encourage our patients to get them here, because I don't know how Amazon stores its supplements. I don't know that their supplements haven't been sitting in a storehouse that's 200 degrees in the summer. I just don't know. I don't know, I don't buy supplements or skincare products for that matter, online. On Amazon. Bariatric Advantage has a program you can sign up for. There's a little card over there. If you sign up for like an automatic delivery, they give you a 10% discount and all the shipping is free. It's kind of another nice way to just sort of stay on track. You can log in and change the products as you want, but that's a neat thing that they do for our patients. We have an e-store on our website that also you can link to any of these brands through there, so it's easy to find. And there are some samples of some of the chewable options over there as well. So keep in mind, these vitamins are more expensive than over-the-counter vitamins, but you've got to keep in mind that they are chemically modified to be absorbed by your new anatomy. They've got the right amount of nutrients that you need. It is really important. And also think about all the money you're going to be saving by not eating all that fast food and coffees. This slide, y'all, was made like 5 years ago. So this fast food 3 times a week is no longer $100, it's $200, okay? So you're going to be saving a lot of money on food. So it's going to be a very still financial benefit to you having had the surgery, eating the right foods and getting on the right vitamins. You're going to come out, it's a win-win. Okay, so as we talked about, you need a bariatric multivitamin and you need calcium. We will be checking your levels. So as we find things that are low, you may need something else in addition, but typically we don't find deficiencies if you're on bariatric vitamins, with the exception of vitamin D. A lot of people are low in vitamin D. So for anybody, even if you don't have a diagnosis of low vitamin D, we often encourage you to take a vitamin D supplement every day, but we will be checking those levels. Other things that are helpful. There was a big study done at Stanford, looked at 10,000 patients who had had bariatric surgery over 10 years, and they found that the arm that took a probiotic every day maintained their weight loss much better than the arm that did not take a probiotic. So again, as I mentioned earlier, our gut microbiome, we want to keep it healthy and happy. It is intensely and intimately involved in our emotions, in our habits, in our cravings. We want to keep it good and healthy. So a probiotic every day is very helpful. We want you to avoid non-steroidal anti-inflammatories, right? NSAIDs, ibuprofen, aspirin, Aleve, all of those non-steroidal anti-inflammatories put you at a significantly higher risk for ulcers. Tylenol is fine for pain. For anti-inflammatory, we recommend curcumin. We have a product here called Mariva that is a good curcumin supplement. Omega-3 fatty acids are other good anti-inflammatory natural supplements. The amino complex that we sell here is basically a pre-digested protein. It helps you increase your protein without breaking your fast. It's an excellent product when for people who are, well, which should be all of us, when we're exercising. You're using those muscles, right? That amino complex gives your muscles all the building blocks they need to repair and stay strong, especially while you can't eat a whole lot. It's also, as you're advancing your diet and not able to get in a whole lot of protein, it's a good way to make sure your muscles are getting the amino acids they need. The one caveat I will tell you, because I take this every day, it says put it in 8 ounces of water. Absolutely not. Do not do it. I put it in 32 ounces of water. Okay, and you're welcome to. That's one of those things you can sip on for hours because it's not a meal. It doesn't have calories. Okay, so that's a good product to help make sure maintaining muscle mass. Biotin is really good for hair and nails. Hair loss is a normal part of a rapid weight loss process. It's normal. It will come back. If you want to minimize hair loss, I suggest taking biotin, 5,000 micrograms every day. We sell one here, but you can get biotin anywhere. The omega-3 fatty acids and the amino complex also are very helpful for maintaining hair health. Your weight loss is going to, you've seen this before, it's going to plateau. You're gonna drop, plateau, drop, plateau, drop, plateau. Don't panic when you hit a plateau. But keep in mind that you've gotta stick with, you've gotta stick with your weapons. So when this happens, it's normal, it's natural, but keep in mind those weapons. Am I drinking my water? Am I exercising? Am I focusing on protein, very low carbs, and choosing natural, non-processed carbs? Am I fasting between my meals or as a snack here or there it's creeping in? Am I taking my bariatric vitamins? Am I on top of my follow-up? Am I keeping up my appointments? Go through your weapons. As long as you're doing those, you're gonna be fine. You're gonna hit that next drop, okay? Documenting your journey is also helpful. All right, taking pictures of yourself and keeping track of them is a nice way to see. A lot of people will find that they see themselves the same in the mirror. It's a really interesting thing that can happen. You've chosen your identity, you have this vision of yourself, and it doesn't always change. And so it's neat to take kind of a photo journal because you can watch that transformation happen. It's cool. We have a support group is through Northeast Baptist Hospital. There's a flyer back there you can take a picture of. They do an online support group. We also have a virtual support program that is, we partnered with FitMate. So there's a little flyer in the back. There's a QR code you can get, every day, all day dietitian support. You just through texting, and then you have once a month you have a face-to-face meeting. So we have that available too. On our website, we have lots of resources. Go to that patient support tab I was telling you about. There's a lot of stuff in there, and if you go into patient education, you can watch videos of these classes. You have the whole dietary handbook, the whole bariatric surgery handbook, recipes, all kinds of good, helpful things for you. We have a newsletter that goes out monthly. We have social media. We have a YouTube channel that's really awesome. Lots of great videos on there given by our doctors and surgeons. And then we're here. You can always call us. You can always email us for any kind of questions or support you might need. I mentioned earlier, that the relationship with food really has to change. The Bariatric Counseling Center on the 3rd floor is a tremendous resource. They help us with changing that relationship with food, coping mechanisms for emotional eating. They have a chef and a gourmet kitchen. They teach you how to cook. They teach mindful eating. It's a really amazing program. I encourage you to take advantage of them, especially while you're in your time off from work after surgery. Veritastic is a free app for you. If it asks for a code, you're going to just use our initials, Sage Bariatric Institute. The code is SBI. But it's a free way that's handy to track your intake. Like I said, we want you getting, our goal is 60 grams of protein a day. We also want you limiting your carbs to under 60 grams of carbs a day. Tracking your intake can be a good way to make sure that you're staying on top of that. Pass that. Okay, if you find yourself having a fever, abdominal pain, not passing gas, not having bowel movements, persistent vomiting or nausea, signs of infection on your incisions, call us. If you are having chest pain or trouble breathing, don't call us. Call 911. Okay? All right, in general, practice your weapons. Know them, tattoo them on your forearm. Hydration, always. Hydration is the most important thing. Next focus is our protein intake. Your meals should in general be, once you're at stage 3, 4 to 8 weeks out, should be proteins and vegetables, little sliver of nature-made carbohydrates. Treat your new stomach like a baby, very gentle and careful as you progress your diet. Start taking your supplements now, but again, not in the mornings. Trust me, y'all, trust me. Don't take them in the mornings. Afternoons, evenings are the best time to take those supplements. No snacking. Fasting is where the magic happens, both now and long term, while you're losing weight and while you're keeping that weight off for the rest of your life. You've got to have fasting swings. You've got to have fasting to kick in fat burning, to do cellular repair, all the things our body needs to do. And then schedule your appointments with dietitians as needed outside of your follow-up visits. Now, we are training a really awesome dietitian right now. Her name is Andrea, and we're super excited about her, but she is still in training. So you can still email dietitian@sagebariatric.com. It will be yours truly answering that email. If it's something super complicated, I'll probably call you. But that's an absolutely great way of getting a hold of us with a question or concern, okay? Outside of medical issues, obviously, in which case you should call the office. Any questions?
No.
No? Okay. Congratulations, y'all. I'm really excited for you. It's a amazing journey, and you are not alone. Just one other quick reminder: there are a lot of people who have done this, who are on TikTok and Instagram, who have a lot of advice to give. Please use caution when following advice that contradicts our advice. Because like I said, we've done almost 20,000 surgeries. We've been doing this for 20 years. We have seen it all. We have seen every fad, everything that people try. The tools we teach you are proven, they're lasting, they work. Please trust in them. If you hear about something new or interesting and you just don't know, email us, okay? Or write it down and ask us when you come in for your appointment. We're happy to talk about it. We don't know everything, and we are still learning about new products all the time. And a lot of times we learn it from our patients. But please check with us first, okay? We don't want anybody derailing. Anything else? Okay, congrats, you're finished. If you head back out to the waiting room, they will call you when your surgeon is ready for you.
Thank you.
You're welcome.